All right, we'll get started now. Hello, everybody. My name is Christine Malin. I am Vice President of Marketing here at CloudWave, and I just want to take a moment to welcome you and thank you for taking the time to take part in our webinar today on AI in healthcare cybersecurity. I'd like to introduce our two presenters. We've got John DiMaggio from Blue Orange Compliance and Michael Wilson from CloudWave. And I will hand it over to them in just a moment. But since we have such a varied audience today, I just want to do a quick introduction and overview of who CloudWave and Blue Orange Compliance are. CloudWave is a cloud services and cybersecurity company serving exclusively healthcare. And Blue Orange Compliance is a security, risk management, and regulatory compliance company that just recently joined CloudWave in June of this year. So we have a combined vision of being able to provide end-to-end security solutions for healthcare organizations in both the acute care and long-term care markets. And with that, I will hand it over to John DiMaggio. John, I think you are muted.
Okay, sorry about that. As Christine said, John DiMaggio, co-founder of Blue Orange Compliance. I've been in healthcare most of my career, roles as Chief Information Officer, and with Blue Orange, been helping healthcare organizations with cybersecurity navigating HIPAA compliance. So very excited to chat with you today, and we're going to have cover a lot of different topics here. So objectives of the webinar, a couple different things. I mean, AI is a big topic. Healthcare is a big space. So one of the things I want to do is understand the uses of AI in the healthcare industry. AI has been introduced, and there's a lot of different roles in it. We're going to cover those. And then how AI is impacting cybersecurity, because it really is providing, it's generating a lot of pros and cons on both sides, and we'll cover that. And the various stages of AI and phases we'll talk about, and identify maybe where you are today and future phases. So that's what we're going to cover today. So first, the role of AI in healthcare, impact of AI in cybersecurity, and the different phases of AI adoption in healthcare organizations. So let's get started with what is AI. Definition, having computers think like humans. The brain is an amazing thing. It's able to process and store information, retrieve information, et cetera. So how can we get a computer to do those same things? And then there's a whole computer science around it of how to get computers to actually do that kind of work and successfully retrieve information. As far as the history goes, AI is not new. It's been around since the 1950s. Trying to get to see how can a machine do the same work as a brain. In the 80s, I don't know if you're around for expert systems, that was the next step towards it, as far as using a computer to do different tasks and think and retrieve information the same way a human would. Machine learning, as technology advanced, we're able to do more things with machines. 2000s internet, lots of data, deep learning, and now in the 2020s where we are today is the large language models, and we'll talk about those. And this is really the first time that technology has kept up and was able to do all the processing. In order for AI to work, there's tremendous amount of computing power. All the training of it, et cetera. And if you were an investor in NVIDIA, those chips do that type of thing. So you'll see there's a lot of investment in building these data centers and more capabilities for AI. That's a little trip down memory lane there. And so we'll talk about large language models. So LLMs are things like ChatGPT, and we'll talk about those, but trained on tremendous amount of data. And basically, the technology is to predict the next word. So all statistical models, when you put something in, ask a question, it gives you sentence information. What is that next word? And that's basically what large language models are.
Hey, John, if I can just
Yeah,
add
sure.
just one quick thing, if you can go back to that slide.
Yeah,
I
absolutely.
think one thing to note is that even though machine learning and AI has been around for some time, I think it's worth just kind of repeating that within the last couple years, we've really turned a significant leap. And what I like to talk about with people is just the Turing test, right? Alan Turing in the 1950s came up with a test. If you've all seen the Imitation Game, it does a great job of, kind of Hollywoodizing this concept. But basically, it was this test to see if a computer could think like a human. And just recently, in the past year or two, ChatGPT, the one of the later models, has actually passed that Turing test. So, kind of an interesting, cool leap in technology and where we are today, just to kind of reinforce that AI really has taken a huge leap forward, and it's something that is really disrupting right now. That's all, John. I just wanted to
Yeah,
add
that's
that kind of
excellent.
a
Yep,
cool little piece of trivia.
that absolutely was. So we'll talk about AI in different parts of healthcare. So as far as clinical diagnostic, now there's a theme here regarding the use of AI. So it's there's almost always a human in the loop, right? So a second pair of eyes. So we've have radiologists, cardiologists that get information back from tests and need to make them some decisions as far as what the diagnosis is and to get meanings out of these uh, results, right? So there's a second pair of eyes now. AI is great at processing a ton of information. So what is normal, what is abnormal, et cetera. And it can do that amazingly fast. So this is one of the things it can do is identify anomalies, like we talked about. Um, Diagnosis, accuracy, looking at accuracy, confirming what the healthcare provider is saying. It can do other work as far as quantifying, et cetera. And the value is it can prevent other healthcare, bad health events from happening. And it's a really good way for a check and balance as far as did I read this correctly? Or I read it a certain way and there's something I didn't see. So it's good all the way around as a tool, either verify, et cetera. The AI will look at something, and again, it's up to the clinician to do it. So it's more of a second pair of eyes than relying on a tool. And that's consistent across all AI. There should always be a human in the loop. Um, Clinical, I have ambient listening here, so that I put that in two different parts. That's where a physician can do an exam. They're talking to you. They're looking at different things on your body, et cetera. And they'll be saying things that normally they'll have to go back and chart or take notes. So I'm sure you've been in meetings where AI is listening, or even in Copilot when you're on Teams meetings. You can have 10 people in a room and be talking for an hour, and it gives a great notes as who's doing what. Similar type of thing. As a physician's there, it can speak what they're saying, and it can listen and record and give summaries, et cetera, that will help it'll help the caregiver, spend more time with the patient or resident without having to worry about the documentation. So this is a huge one, and it's great for clinical because they can spend more time with who they're working with. Robotic surgery is another one. So looking at the situation as far as surgery, past history, are there any pre-op items to do, something that maybe someone might not catch? So that's another thing as far as on the clinical uses. Guiding assistance through the procedure, especially in hips and knees and things like that, as far as lining things up and providing during the actual surgery. And then post-op, looking at what the patient just went through, and are there any things with the rest of their healthcare information that would possibly be a post-op to be on the lookout for that. Medication management, I used to be in the pharmacy world, and triggering interactions and things that have been around forever. But as far as looking at that, and then also the health history of the person as well, can help identify even more things, right? So there's just business rules as far as this interacts with that, with two things interact, or risk. So it's able to detect those things that in a normal pharmacy process might not be detected. So that's another great use of it on the clinical side. On the administrative side, again, ambient listening, it gets 2 awards as far as the administrative. So able to to take summaries of visits, document them well to save time from for the healthcare professional having to do that. And chart summary and EHR integration. So again, taking those notes, putting them in a different form, and knowing you have to do that, and putting it as part of your process kind of frees you from that. Patient scheduling, again, more information. Scheduling is a hard thing, making sure people who cancel aren't, likelihood of canceling, those types of things. So the value here, it's a lot of value. Spending time with the patient or resident, documentation, compliance, things need to be put in a certain way, so it can help with that. And then just sitting there and putting the stuff in all the time, having some assistance there. But again, the human's always in the loop for this. It's just a real time saver. So revenue cycle, where the money is, coding and billing, making sure claims get paid, managing your supply chain. These are all things that affect the bottom line. So that is a major use from an administrative standpoint, to be able to optimize what you're doing and make sure that you're able to get the reimbursement maximized, et cetera. So post-acute care, I know we have a probably diverse audience here. What I was talking about earlier is more the clinical side, hospital side. In senior living post-acute, AI is for fall detection. A lot of the residents live in residential settings, right? So it's not all clinical. So has somebody fallen? Are they acting differently from their normal routines? They usually get up at a certain time and go to the restroom and back. Now something's different. So falls are a major issue for senior living organizations. And one of the things that's done well, some of these technologies, instead of a video, which is kind of a privacy issue, use radar or lidar to look at the movement. So it's kind of intrusive to have cameras in a residential setting. Wander management for memory care. Are people where they're supposed to be? Are there any different types of behaviors? And cognitive support, like for companions, because there's sometimes loneliness is an issue there. So AI is used in all these different areas from a post-acute standpoint. So over to Michael. Michael can introduce himself and talk about kind of the way that cyber is affecting how good guys and bad guys work.
All right, thanks, John. Just a real quick introduction. I don't want to get us too off track here, but a little bit about my background. So my name is Michael Wilson, just like John said, and I've been in cybersecurity for, I just looked it up actually today, and it's been 18 years. So very excited. I love the industry. I'm kind of a long timer. With that being said, the last place I was, my last role was CTO at Newspire, which is a cybersecurity company. And they recently exited about a year ago. And then before that, I was the first employee of a cybersecurity company and ended up exiting with that as well as the CTO there. So basically, I've been in cybersecurity for a long time. Specifically, I kind of specialize with MSSPs, and that's also Cloudwave has a MSSP division as well, and I'm helping out there. So with that being said, let's get right back into the content here. Since we're at the cybersecurity section, I'd like to just say really quickly that with all those cool advances in technology that John just mentioned, with all the new capabilities with that AI are bringing, that means that there's more data out there. That means that there are more ways to attack and to more ways for attackers to find ways to disrupt services, to gain money, to benefit from some of these new capabilities. And that's what I'm going to talk to you all about today. There's two sides of this, and that's how I split up the content here. There's the defensive side, and then there's the attacker side. And I'll go over both of those in more detail in the next couple slides. So first of all, let's talk about the defensive side. This is the more comforting side. With AI, we have a couple more tools in our toolbox now. The first one, just like John said earlier, is anomaly and behavior-based detection. Very, very cool. We couldn't do this before because although we had lots of data, we just didn't quite have the processing power to be able to find patterns and anomalies in the way that things are working to be able to find and stop these breaches from happening. We also have the ability to do natural language triage, which increases how quickly we can respond to an incident. We have the ability to do predictive analytics, which basically just means that we can start to identify potential issues that can cause downtime and get ahead of it. And then lastly is phishing detection, and I'll go way more into that in the next couple slides. But just like I said, with the defensive increase in capabilities, there's also increase in capabilities for the attackers. So you all have seen those emails, those phishing emails that are very broken English, and it's a prince from Nigeria, and it's very obvious schemes. Well, that is no longer the case. Phishing emails today are incredibly, incredibly convincing with the help of AI. You can easily go to ChatGPT and have it type up something. And I'll go more into how that works in a little bit. There's also the capability to do, you all might have heard the term deep fakes, where they can generate voice and basically mimic another person in order to get what they want. And I'll talk more in depth about these next two, but there's also the ability for them to dynamically mutate and generate new threats that happen much, much quicker than they used to. About 5 to 10 years ago, when a new vulnerability was released, what would happen is a lot of these development teams in some of the adversarial countries would immediately start working on programs to start taking advantage of those vulnerabilities. And it would take them, a couple weeks in order to execute those. Nowadays, I'm sure everyone has seen this, but AI can write code on the fly and be able to turn these vulnerabilities that are released around in almost no time. So it's very scary, but we have new capabilities. If we can go on to the next slide, John, I'll talk a little bit more about the attacker side. So on the attacker side, this is really interesting. To me, I get kind of excited about it, but it is a little scary, I'll be honest. The deep fake voices are something that is definitely out there. It's going on. It's not very, very common. It's not widespread, but it does happen. It's something for you all to be aware of and just kind of understand, make sure that you talk to your employees about it. The next one, there's a new term that came out for these phishing emails, and they're calling them synthetic emails. And the reason is because you basically can't tell them apart from real emails. Phishing has become such a common way of intruding into an environment to deploy malware and ransomware that at this point, at this day and age, anytime I'm talking to an enterprise, whether they're in healthcare or not, I always start with the most common way to get breached is phishing. So that's probably where, for anyone on this call, if you want to start somewhere, I would probably start with phishing training. These are things you can do very simply. Like I said, with AI, the way that they are building programs to exploit vulnerabilities nowadays is incredibly advanced. At a very high level, basically the Norton antivirus that your mom and dad used to have on their computer, that doesn't work anymore. It just isn't advanced enough. Antivirus as a capability has no longer been fruitful for quite some time now, and especially with the advances of AI. And the reason is because if there's a bad program that you execute on your machine or in your network, if a signature comes out to identify that program, they can just rewrite that program using AI in a way that changes it just enough to get past those detections. And that's happening almost instantly now. So that's the new capabilities that they have for malware mutation. The last thing I'll mention, and I'll stop scaring everyone right after this, I promise, but the last one to mention is how easy it is to deploy now. I already talked about phishing, so I won't go into that, but what I want to make sure you guys understand is it's more than just going to ChatGPT and saying, type me up a phishing email for John DiMaggio and ask him to reset his password. It's much more sophisticated than that. So what we're seeing now is they are using LLMs to scrape social media sites. Think LinkedIn, think Facebook, anything that they can find out about the employees. Based on that, they're coming up with a plan A, B, C, and D in order to get through different employees to find a way to get to the person with the most privilege. And these are very sophisticated plans that, basically impersonate executives in the company. They'll impersonate bosses. It's becoming a very serious threat. And that's why I'm spending so much time on phishing specifically, because I feel it's the most important one to probably start with. All right, now onto the safer side. Let's move on to the defenses and what we can do to protect against these new capabilities. So I broke these into 3 different sections. The first one being predict. And some of these tools don't really fall into predict, but it's important to have all of these tools in your tool chest in order to protect you. So EDR is endpoint detection and response. This is the new age version of antivirus. So the way antivirus used to work is it would look at signatures. If a program looked like a bad program, then it would block it. The new tools like EDR, what they do is they look at more of behaviors and patterns and how things are working to identify and stop. They're no longer working based on signatures. So I'd encourage all of you to check your technologies, make sure that you're using something modern there. MDR and XDR are just, that's basically new terms for monitoring endpoints, as well as extended detection and response is what the XDR is for. And that's kind of using a SIM to correlate all of your events with your endpoint data, with your server data, with your network data. Basically, what I'm trying to get across here is make sure that you have a really good semi-modern security stack so that you make sure that you're not missing any low-hanging fruit there. Also, make sure that the security tools that you look at are actually using true AI and not just saying, we also do AI, because that is a theme that we see with a lot of products these days, is that everyone wants to just bolt on some AI capabilities. It's really important to understand and to vet out these tools and make sure that you're really getting what you pay for. Onto the preventative side, and this is really John's and Blue Orange's bread and butter, is on compliance. Making sure that you are staying up to date with the most recent regulations, making sure that you are staying compliant and understand where you are weak, that you're constantly improving those. There's also this concept of continuous risk scoring, and I've seen a couple tools out there pop up that, and this is starting to become more of a common thing, where you are dynamically scanning your environment in order to get a live, up-to-date, and also historical reference of where you are at from a security score perspective. The last thing I'd mention is like an ASM or some type of vulnerability scanning tool. ASM is just like the new age way to say vulnerability scanning. It's much more in depth, but it stands for attack surface management. And basically, there are some attack surface management tools out there, and what they do is they basically emulate an attacker. They try to understand where are all the ways that we could get into your environment. As an example, do you have a website? It will automatically scan the website, try to figure out what vulnerabilities you have, and see what you look like as a whole to the attacker. So it's a very important part of your toolbox to help you prioritize where to spend your time and money. And then the last thing is you obviously need a way to respond if something bad does happen. In the very sad circumstance that anyone here has dealt with ransomware or has been through a situation where you've either had to pay or restore or lose a ton of data from a ransomware attack, the best advice is make sure that either you have the skills internally and you're constantly staying up to date on a lot of the attacker's perspective, or just find an MSSP that you trust that has the skills so that you don't have to stay up to date and train on them. CloudWave, we have an entire team who is trained and constantly staying up to date on these things so that our customers don't have to. It's often cheaper and better to outsource this capability than hire internally, unless you're a really large organization that has a large team that can have these programs to keep your teams educated and up to date. And then the last thing is, if you're looking at MSSPs and you're trying to figure out how to respond, how to react quicker, then I would recommend looking at a SOAR tool. This is kind of the last step in security, which is why I put it here at the end. But a SOAR tool is it stands for Security Orchestration, Automation, and Response. And what that does is it's basically a platform that when something bad happens, let's say a machine gets infected with malware, what the SOAR tool, the automation tool, can do is automatically see that event and go and quarantine that machine, just as a very rudimentary example. And why this is important is because, as some of you might know, ransomware proliferates itself very quickly, and the response time is critical to reduce your exposure to the negative effects of ransomware. Next one. All right, this is the last one, and it's kind of like a simulation of how a AI-enabled breach from an attack standpoint might happen. And I'd say more than likely, this is, like, in my experience and also talking with John and our teams internally, we basically use the most common methods for each of these different steps in order to make it as realistic as possible. So first things first, reconnaissance. I've already talked to all of you about the new tools and techniques that the attackers have with AI, and that's what this is referring to here. It's scraping all those social media sites. It's gathering all the employee data, understanding about their family and trying to find personal ways. The use of an LLM is so much faster in order to gain an entire dossier of a company and their employees and staff to find the best method to infiltrate. Deception, I talked about this a little bit earlier too, but this is the actual phishing part. This is the part where they're tricking you into doing something. It's an email from the CEO. I really need you to buy these gift cards immediately. I've seen this one specifically 3 or 4 times, but you need to do this immediately, and it sounds so authoritative. That's the next step in the breach, is the actual tricking part. AI makes this so much easier today. It's no longer easy to detect these by just some looking for typos. It's much more sophisticated today, so just watch out. The next step is going to be penetration. Now that they've tricked you into clicking on something or doing something, the next step is I need to get in and increase the amount of surface that I have a hold of. And this is where, when we talk about malware mutating and bad programs, and we talk about bad programs automatically transforming themselves to get around signatures, that's this one specifically. The next one is privilege escalation. So now that they're in your environment, that's the penetration part. The next thing they're going to want to do is go deeper. And what I mean by deeper is we might have 100 people in our company, but there's only 3 or 4 administrators that have the keys to the entire castle. Privilege escalation is all about trying to find the quickest way to get to those ultimate administrative keys. And with AI, what they're doing today is they're making it super easy to say, let's say I get the receptionist password on her laptop. AI helps them understand what is the path that attacker needs to take in order to go from the receptionist username and password all the way to the administrator, the IT admin's username and password, so that they can have much more surface area. And then the last thing is where they actually profit, or where we're actually impacted as the defender. And that is with exfiltration of data, where they'll either steal data and hold that data for ransom, or they'll sell that data on the dark web, on the black market, or they'll hold your data for ransomware. And I'm sure all of you, I know I don't even have to define ransomware. It's so prolific at this point, but that's generally the next step. And then obviously you all know what happens after that. They either request and demand money, or they delete all your data and you'll never have access to it. So this is kind of the normal, most common method that we see of an AI-enabled breach. And with that said, all the doom and gloom kind of over. I'll hand it back over to John, and he can cheer you guys up for the rest of the webinar.
Excellent. Thank you, Michael. So we went through the different uses. Everybody's fully terrified now of the ways that AI is used in both ways. So we're going to do something kind of positive here. So how you've all got heard of AI. So how can AI be used in your organization? How, where do you get started? And kind of the different phases of AI, kind of figure out where you are and maybe how to get to the next step. So one of the things in a planning is, use cases. You look at your business and say, hey, here's a good candidate for, taking something, looking at it, analyzing it. Maybe we have people doing it. Maybe it takes a lot of training to do it. So that could be a thing. From admissions, we'll go over a couple different use cases, or there's a ton of work to do on the back end. It's very repetitive. Is there something that we can do there to save time and put people to solve other problems? And different use cases. So, what are those things, and what are good candidates for this? And then, to be able to figure out where, in your regular business workflow, where could AI kind of be inserted to improve, reduce the amount of work, or get better information. So that's kind of the planning. Kind of take a look at your organization and where this might fit. We'll kind of get you kind of started here. One of the things that's super important here is, depending on what you're going to use AI for, figuring out the right kind of tool. So the LLM, the public LLMs versus HIPAA compliant. So the public LLMs, you hop on your phone, you hop into Gemini, and you ask a question, tell me about XYZ, gives you some great information back, etc. But it's a public tool. So it's not HIPAA compliant. It's not something where you want to put any kind of personal or proprietary information in, because that information goes in and trains the rest of the model, and it may pop up. Now, even if it's something like HIPAA data, it's illegal to put information into that type of environment. So the public LLMs, we'll talk about good ways to use those. But if you're going to use it for any real business problem, you're probably going to run across some type of proprietary information or protected information. So you want to pick the best tool from a HIPAA compliant. But one of the things we'll talk about is policies and procedures, and where AI might be in your environment and what people are using it with today. We'll get to that in a second. So HIPAA compliant LLM, they are out there. They're private LLMs. They meet all the requirements for HIPAA and private information. You'll know that because they'll sign a business associate agreement, right? That's them saying that they are meeting all the regulations of HIPAA. And since we're talking about healthcare, we're usually talking about health information here. And that data that you put in is not used to train the public model. So you can use that information for whatever tasks you need to do. And the cons of that is, on the public LLM, it's free. So you do a Gemini or ChatGPT, you don't get charged for it. But these environments are specialized. Example is Microsoft 365 Copilot. That's a paid license. So to do any quote real work, there's licensing fees. Some are licensing fees, some are pay as you go. You get tokens, etc. But that's the way that these organizations are monetizing this capability. So first thing you want to do if you're going to do anything with any real business stuff is trying to figure out what kind of tool you're going to use, and any kind of information, any kind of personal information or proprietary trade secrets, et cetera, you should never put into a public LLM. But that's the difference. I wanted to make sure that that's a clear point going forward. So we'll talk about the different phases here. This is the way I kind of break them out. Phase one could be today. You don't know where you are. AI is a thing. I guarantee you that people in your organization are using it. And if you don't have a unknown phase as far as, kind of called shadow AI, just like shadow IT, it's being used, but it's not on anybody's radar, not in a formal way. So that's phase one. So one of the things we don't get out of that one. Phase two is casual, how you can use AI using some of the public tools to get to have it add business value. Third is operational, and go through all these as far as solving a particular business problem with it. And then, phase four is strategic. You're going to implement your complete business strategy using AI as a tool. So those are different phases. And then at the end, kind of think of where you might be and where you might want to be. So phase one, unknown, shadow AI is bad. Okay, so this is could be today. Maybe you don't have a formal policy on AI as far as, hey, AI is here. Here's what you can use it for. Here's what you can't use it for. A good step is to at least, say you can't use it unless you're authorized to use it. It's a good way to put a stake in the ground. But if people are using it, you know what they're using it for. They haven't been trained on what you can use it for, et cetera. So that's kind of the unknown. And this is a scary one here. Hey, I want to build a care plan for Mary Smith. Is on these eight notifications. You violated all kinds of laws and privacy, et cetera. So you want to make sure that people, your organization knows what, are they allowed to use it under what circumstances? So this is the phase one unknown phase here. The casual one is hey, you have a policy, okay, and you say, hey, you can use AI for this type of information. If you're blue orange client, you have a data classification problem, so you can use this type of data through a public LLM. Okay, so it's telling you what you can do with it. Here's an example. Geeky one, regulation, title, et cetera. It's a regulation. I want to know how that's investigated, right? You put it into ChatGPT or Gemini, et cetera, and it'll give you all kinds of great information about it. Again, human in the loop. You want to use this, and obviously you're going to use it for anything serious. You want to make sure it's accurate, right? So this is a good way to just get general information, and if this is part of your policies, you can use it for general information without proprietary information. This is legitimate, right? And it's a great tool for anyone to look something up or research something, figure out a small problem, doesn't have any sensitive information in it. So it's a great use, and I'm sure a lot of you use this on your daily for personal reasons. So examples of this are the free Copilot, the free Gemini. If you're not paying for it, it's probably a public. And there's all kinds of other ones out there. But these are great, give great information back. It's good to kind of mix and match, et cetera. But that's the casual use. Again, difference between that and the first one is there's some kind of policy that says what you can and can't use it for. Operational AI. So this is, you found a business problem, and you think that AI would be a great candidate to solve that problem. So there's things in AI called agents, which are things that you build. They're AI based. You basically tell them who they're supposed to be, what kind of problem they want to solve, how they should be trained, how you want the information back. We'll go through an example here. And then look for different use cases. So it could be review an application, looking for assessment, generate treatment notes, those types of things, and figure out how to integrate that with the workflow. So it could be someone's tasked with analyzing something and coming up with results. Give them that tool to have it take the first pass at it. Again, the human take a look at it, and that might save them time, or even give them information they wouldn't get normally, right? So this would be solving one business problem with this technology. The third, so the phase three, the operational example here is, you submitted an application. Now this could be This example could be someone applying for a job, or I know we have a lot of senior living folks have waiting lists to get in applications to get into your community. Some have, multi-year waiting lists, et cetera. Those applications usually have a financial piece, credit piece, health information, et cetera. And there's a ton of information there, right? So you could build an AI agent and say, hey, I am, when you're talking I, and you're putting in third person, I am a first person. I am an analyst. My goal is to approve an application. Here's things that I look for. I want a summary of financial information with 100% being the best, et cetera. So you're actually training it. You're actually giving it knowledge. So here's a link to our admission policy. Here's things that we take a look at, training it on things that it would need to know to do this. How you want the information to be presented. I'd like a summary of the financial first, a summary of it, then followed by detail, the reasoning of why it came up with this particular score, something you can give to a human reviewer to take a look at that, obviously do checks and balance on it, but it can really save time and deliver consistent information. So that's an example of taking that to solve a particular business problem. So strategic AI is kind of, you're going to use AI as a business strategy. One example is Amazon. So they are going to predict their demand for certain seasons, right? Demand is going to be X. Based on that demand, we're going to implement a certain pricing strategy. What's our optimum pricing strategy to get the optimal? So during this demand season, et cetera. And then based on that, we're going to have peak flows. So what's the most cost-effective way based on the first two steps to get this information to the right place? How are we going to staff these people? Make sure we're not understaffed, overstaffed. How to get it to the next level. So that's actually using AI for to manage your business in all different ways. So that's a strategy. Usually we're seeing, folks in hopefully the phase 1, 2, starting to see phase 3 as far as building some particular agents to solve problems, seeing how it goes, and then planning for the kind of the next process. So those are some different ways of those phases. And if you can kind of think of where you might be, that might be a good thing. And what level do you want to be in? Because this is a technology, if used correctly and compliantly and safely, can save time, increase accuracy, and all types of things. You want to try to prove out, the value it's going to add, it can bring, what it's going to take to implement it, et cetera. So again, it's a good business. Could be good for your business, and to kind of start small and at least get out of phase 1 into phase 2 where actually folks are using it and they know how to use it. So here, for questions, Chris, if you want to take it over here, you can pop some questions in. So for takeaways, take a look at your current state, right? We talked about all the scary things that AI can do. Keep an eye on that for your security. It's not the same world that it's used to be. And then, what are some ways if we want to use this to get to solve some problems, improve the business, improve accuracy, better care for residents, patients, et cetera. We have a Navigating Healthcare for Cybersecurity with AI ebook. We have a policy template. If you're interested in that, let us know. And with that, I guess we can take questions, or Chris, if you want to
Sure.
take to the next level. Yeah.
I don't have any questions in the chat right now,
Okay.
but if anybody in the audience would like to put one in, we'd be happy to answer it at this point in time. Or you can raise your hand.
Right.
And while people are thinking of their questions, we'll just go back to that AI ebook. We'll follow up with all of the people that attended today and registered as well with that ebook. So you'll have a link where you can download that. I think you'll find that content useful. And then the AI policy template that can be adopted for your own organization will be coming soon. We will follow up with that as well.
And many of you might be going to Leading Age. We'll actually be there. We'll be in booth 848. Come visit if you're going to that conference coming very soon, a couple days. So thank you for your time. Hopefully give you an overview of kind of where things are, maybe where you are and where to get started.
John, we have a question.
Yes.
From Anita Browning. And her question is, do you have ideas or considerations for AI in medical education?
Medical education. I'm sure it's used a lot in the free LLM model to research certain things, target. I can see it used that way from a formal use. You could use it to come up with generate the outline for a great training program with content to train somebody on whatever type of whatever part of medicine that they're working with that's good at that. It usually will give you a great step on that of creating content, training schedule, how to present the content. So that is, you can use it for that, for planning purposes, and it'll get you pretty far as far as, and you can say, hey, give me more detail, etc. Obviously, you want to make sure it's legitimate, but that would be a way to, or if you have a special role inside your organization that you want to have more detailed training and maybe some homework of here, go research X, etc. So that's a good way you could be very specific. The more specific you are, as far as I want to train someone on this particular role, it's in this type of environment. Here's the job responsibilities. They need to do X, Y, Z. Can you build a detailed training plan and go from there? It's you try something, you say more detail, less detail. What about X? Can you add X? You can get pretty far with that. So that's a great way to start that you can do with a free the free LLM out there.
Excellent. Any other questions? All right, I don't see anything right now. CloudWave and Blue Orange compliance are always available. So
Absolutely.
if you
Contact info right there. Yep.
Yes. If you think of something after the webinar, we'll be reaching out with the follow-up recording. You can always send us an email and we'll get back to you with an answer.
Thanks, everybody. Have a good day.
Thank you all.
Thanks. Bye.
Thank you very much.
Bye.